Hi, Dana Phillips, nurse practitioner here with All Things Nurse to give you advice on nurse life for RNs and NPs. Today I'm going to talk to you about how to manage stress as a nurse. And personally, for me, as a new nurse, I had a lot of stress and anxiety. I worked on a very busy cardiac step-down unit with lots of codes, high acuity. So my own personal journey was that I was dealing with really bad anxiety to the point of having chest pain, palpitations. It was almost like I was taking on the physical symptoms of my patients. I consider myself an empath, and so I easily can absorb people's energy, and so I had to really learn ways to shield my energy and focus on my self-care. So today I'm going to give you 7 tips or 7 things to incorporate in your daily routine to maximize your self-care methods. And so you can go to work and be your best self and also be your best self at home. So tip number 1, get good sleep. Okay, there's really no way around it. Whether you're doing shift work, which is night shift, or working day shift, you need to get optimal sleep, especially in between shifts. So whatever it is, whatever you need, blackout curtains, sound machines, herbal remedies, such as kava, valerian, and melatonin are good over-the-counter herbal supplements to try for sleep. You can also take some over-the-counter medications such as Tylenol PM. It does have the diphenhydramine in it though, so it does have a drying effect, so just be careful with that. Sometimes it can give people weird dreams as well, so just take with caution, and also consult your primary care provider if you have any questions. So sleep is critical. You need sleep. Number 2, diet and exercise. Okay, there's really no way around that one either. Exercise, try to get at least 3 days a week, 50 minutes per week, or sorry, no, 150 minutes per week of exercise, cardio, weight training, whatever it is. And diet, whatever we put into our body, that is the fuel that comes out with our brain power, our physical performance. I know everyone has different diets and different exercise regimens that work for them, so do whatever works for you. Do your research on those topics. I'm not going to go off on a tangent about that. There's plenty of YouTube videos around those topics. So number 3, breath work and meditation. So I don't know if I have any avid yogis out there. Yoga is a wonderful outlet to use to manage stress and anxiety. Personally, for me, yoga has been a godsend. It has been a lifesaver. There are a lot of apps out there. There's the Calm app, CALM. They have a lot of guided meditations and breath exercises for you to learn. And I highly recommend that. So one thing that I kind of took into practice was I would take my yoga breath work to work with me. So if I had a moment where I was losing my SHIT, I would step into like a supply closet or a linen closet or whatever, and just do even if it's 10 seconds of deep breathing, to just kind of reset yourself, especially on days that are extra stressful or that you have just those difficult patients. You need to stay in your right zone in order to survive. So breath work and meditation, highly recommend. Number 4, spend time in nature. On your days off, get outside, breathe the fresh air, get around greenery. I know that sounds cliche, but it's something about being in nature helps reset your nervous system. When you're in the hospital, there's lights, there's dings, there's bings, there's people's energy, there's doctors, there's the patients, there's other nurses. There's so much going on energetically. So you need to get outside in nature where you can just reset that nervous system and kind of just clear your aura of all of that stuff. And then number 5, pursue your hobbies. So whatever that is, art, reading, knitting. Take that time on your days off, even if it's just little 20-minute increments or whatever you can fit in. Pursue your hobbies, because the hobbies are what is going to get your creative juices flowing and also fill up your cup, okay? Like, I know you've probably heard that before. You can't pour from an empty cup. We need to be filling our cup on a daily basis so that we can show up for our families and our patients. Number 6, seek professional help. If you feel like your anxiety is just spiraling out of control and you are not able to manage it with daily practices, then go ahead and seek counsel from your primary care provider. Call your insurance company. See if there are providers that they can suggest to you in your area for mental health services. You can see a social worker. You can see a psychologist. You can see a licensed mental health counselor. You can see your primary care provider, whether it be an MD or an NP. All of these people can provide you with resources for mental health services, and MDs and NPs can prescribe medication if that's something that you need. So there are so many different platforms to access mental health services. There's also certain programs through your employer called FNP, I believe, which provides mental health services for employees. So check with your HR or whatever. But anyway, so there are different apps. There's Talkspace, I believe it's called. That is an app where you can access telehealth providers at the touch of a button on your smartphone, okay? So seeking out mental health services has become easier than ever. And I personally believe everyone should have a therapist, okay? I've been seeing a therapist since my early 20s for management with anxiety and depression, and it's been life-changing. So I highly, highly recommend seeking therapy. Even if you feel like you don't need it, or even if you feel like you think you can do it on your own, I've been there before, and why suffer? Just get help, okay? And then lastly, number 7 on the list is medication. I mean, if you're getting to the point where your anxiety symptoms are overtaking your life and you can't function, talk to your primary care provider about potentially starting an SSRI to help with combating those symptoms. Me personally, I've been taking SSRIs off and on since my early 20s for anxiety and depression, and they have definitely helped get over a lot of humps in life, get through a lot of difficult times, and it helps with those visceral symptoms that people can experience, with anxiety, like the chest pain, palpitations, lump in the throat, ruminating thoughts, feelings of doom. So if you're experiencing any of those things, please contact your primary care provider. I hope you enjoyed this video on tips and tricks to combat anxiety as a nurse. Like and subscribe to my channel if you would like to hear more topics about this. Thank you.